Good afternoon, everyone. My name is Dr. Anwar Sadat. I'm a specialist orthopedic surgeon. I'm working at Medcare Orthopedic and Spine Hospital. I'm specialized at shoulder and knee injuries, and I have been working with Medcare for the last 10 years. My specialty is ligament injuries connected with shoulder and knee. Today, I'll be talking on ligament injuries focusing on the knee. So to explain things a little bit, I would just start off with the basic anatomy of the knee. So the knee is basically a simple joint which is unidirectional. It just flexes and extends. It's composed of muscles, ligaments, and bones. So there are flexors which flex the knee and extensor which includes quadriceps which extends the knee. The bones which are included in the knee joint is the femur, tibia, and the kneecap, which is formed by the patella. So knee, unlike the other joint, is a very unstable situation. There is no bony contouring which makes it stable. So to stabilize things, there are ligaments which makes the knee quite stable. To stabilize it from side to side, you have the collaterals, that's the medial collateral ligament and lateral collateral ligament. And to stabilize it to front and back, there are cruciate, the anterior cruciate ligament which stabilizes it anteriorly, and the posterior cruciate ligament that stabilizes it backwards. And in between the knee, we have a cushioning mechanism which is called the menisci. The menisci is usually divided into medial menisci and the lateral menisci. The medial menisci comes in the inner side and the lateral meniscus comes in the outer side. That basically explains the anatomy of the knee joint. So usually we get a lot of patients with a lot of issues with this. Mostly are injuries to the ligaments. So injuries can be divided into traumatic ones and degenerative ones. So young people who are into sport and exercises sometimes injure them while doing some sort of mobility which twists the knee, having a sudden shearing movement which may injure the ligaments and meniscus. There are also people above the age of 50 or 60 because of the repeated movements and degeneration who develops degenerative tear. Another way of classifying the injury is based on the anatomy. We can divide ligamental injuries to cruciate ligament injuries, collateral ligament injuries, meniscal injuries, which has to be discussed differently based on the treatment options. Another way as a surgeon we look into is dividing it into healable and non-healable. Because after an injury, there are 60 to 70% cases which will heal by itself. All you have to give is time. Let the body heal itself. Don't irritate it. Sometimes we end up exercising too early, making the injury worse. We don't rehab it, so it becomes weak. So in a way, a lot of injuries can heal by itself. But there are certain injuries right from the start. If we don't treat them surgically, it will never heal. So whether it needs a surgery or not, it's another question. But generally, we can always classify right from the start whether it's a surgical problem or not. Generally, we get a lot of patients for these sort of ligament injuries because the fitness and sports are increasing day by day, and the demand from the patient side is also increasing. So we end up seeing a lot of ligament injuries on a daily basis. So this was in a nutshell. So ultimately, we can always discuss things based on what is the problem, and we can always go ahead further. I'd like to introduce Anas, who is the head of marketing team, to ask me certain questions so that we can clarify a few things.
First, thank you, doctor. Lots of things that we discussed is about the ligament. Thank you for explanation, but I wanted to understand, doctor, when you mentioned the ligament that it's on the knee, is there another place that not the knee, maybe the hand, there's the ligaments that something will happen thrown or something that you face as well, or most probably only in the leg?
No, see, ligament is something which connects the bone.
Correct.
So usually anywhere there is a bone, there is a ligament.
True.
So usually even for the fingers, there are 3 bones here. So
There is a
usually
ligament.
automatically these bones are connected by ligaments. So ultimately some ligaments gain importance because they need a surgeon to fix them. Most of the ligaments heal by itself. So a ligament which will heal by itself just requires time. It doesn't need a surgeon to intervene.
By itself.
By itself.
But there is some cases that you need to intervene, like maybe the ligaments of shoulder.
Yes.
That's possible, and maybe the hand, ankle, these things, all of them, it's there.
Yes.
But the major one is the knee.
Yes.
Why is that, doctor?
See, in terms of our day-to-day activity, for example, my daily routine definitely includes a lot of walking, standing, climbing. So a knee is one of the things which always comes into picture on a day-to-day basis. So if I have a shoulder problem and a knee problem, most probably I can live with a shoulder problem without causing much injuries because I'm never straining it.
You can relax it a little bit.
Yes. But usually whenever we stand, we walk, our own weight becomes a culprit. So usually if I have a ligament injury, it always stresses and it always causes problem for me. So compared to shoulder and knee, a lot of problem comes for knee problems because it becomes pretty symptomatic on a daily basis.
Because of the use and misuse maybe of it.
Yes.
Okay, I do understand, but just wanted to understand that a lot of people can also be having some problems, which is ligament and through their shoulder or anything, and they can also see a doctor that they should sometimes. It depends on their case. Doctor, we were discussing about the meniscus. So what type of surgeries are done for the meniscus?
Yeah, see, meniscus is the C-shaped structures in between the tibia and femur. So it's like a cushioning system.
Correct.
So treatment is a lot of variation because we get patients sometimes coming for second opinion, third opinion, should I need a surgery and all those things. So finally, treatment is not based on the injury, based on the patient. If it is symptomatic, it has to be treated.
Okay.
So based on the tear, so if it I can divide meniscus into area which has a very good circulation and area which doesn't have a circulation. So if it is torn in an area which is having a very good circulation, it can heal by its own. So just giving time will help. Whereas if it is torn in an area without blood circulation, it needs to be either repaired or we might have to end up trimming that area, which is giving symptoms. So usually it's classified as meniscal repair or a partial meniscectomy.
And the surgery, it's not going to be huge. It's going to be like kind of procedure, or is it a surgery? Because surgery, people get a little bit afraid of it.
So normally these surgeries are called keyhole arthroscopic surgeries. These are mostly daycare surgeries. The patient can definitely go home the same day. Because I would say the skin is the most painful thing in our body.
True.
So bigger the incision it gets,
Pain
greater the pain. So if we can minimize the skin incision, and usually these sort of surgery need only a stab incision, which is less than like a half a centimeter size, where 2 incisions are always required. One is to introduce a camera inside the knee, and other one is to introduce some sort of like devices to do the procedure. So once you close up with a single sutures, the patient can be mobilized pretty early. So for instance, you were asking about a meniscal problems. So in meniscal surgeries, mostly it's a daycare surgeries. Patient can start weight bearing and walking, or even start doing almost all the activities by the same day.
Wow. So if I did the procedure or the surgery, I can walk in the same day, or
Yes,
I should take it a little bit easy on it?
No, definitely. Taking it easy is always like surgery, big or small. We don't want to take chances. We are just talking about the recovery pattern. So usually a patient can start weight bearing, can go to the toilet, go walk
Yeah,
around and all
the
those
normal
things.
stuff, not go to
Yes.
work and run around and
Yes.
do all these
So
things.
if a patient asks me a specific question like when can I go to work? Suppose he's sitting in an office all the time. Okay, by third day, fourth day, he can start off with the office work. Whereas if he is a person, he's always standing, he's climbing steps, then I will go easy on him. Most probably, he may require.
I just hit my mind right now, doctor. I want to ask you this question. Can I drive when it's fine after the surgery to
See,
drive?
legally, no. But like
Okay.
if it is like a left knee, obviously here most of
Yes.
us are driving automatic. So mostly we end up using only the right foot.
The right, but if I did it in the right, I cannot drive.
Yes. So I would always say no to driving for at least 10 days till the sutures comes out.
Because you're using the knee when
Yes.
you're driving as
So
well.
it's not because it is dangerous, but
Yes.
post-surgery there can be sometimes sudden painful episodes, which can be like you're driving and it can be dangerous for others. So
Okay.
it's not the surgery that prevents you, but to be on a safer side for the others,
Of course.
we should be avoiding driving.
That's really nice. And doctor, you were mentioning about the meniscus that you trim it.
Yes.
I don't understand exactly how does it work. Like this is the meniscus,
Yes.
okay, and then here is the two bones. So basically, how the inflammation? How would it look? The inflammation. So this will be gone.
Yeah, see, that's a very common question which we get. Like whenever we say, let's trim it, the first question the patient asks, oh, that's something very useful to me, and you're going to take it off. So will it be causing further damage to me? So I usually always explain, like, I take a pic. So if I am, suppose this is our intact meniscus.
Okay.
I pull it, nothing is happening.
Correct.
Suppose I have a small tear like this. What happens is this keeps coming in between. Just like if I am chewing food and my gum comes in between, it gives me painful episodes.
Okay.
So this piece of tone tissue comes in between, causes impingement, sometimes locking, which are painful. So if a patient decides, no, I'm not going to do a surgery, what will happen is because of repeated episode, it will keep tearing.
Oh, and
Whereas, like, okay, if a patient agrees for surgery, that's a tear, you end up taking it off. Now
and
it
then it's
becomes
gonna be
stable.
stable.
So in a way, we are reducing or minimizing problems for the future whenever we end up doing like a meniscal trimming.
I didn't know all of that. Okay, doctor, you said that also it heals by itself. So
Yes.
if I have some kind of a tear and I want it to heal by itself, is that possible? It depends on how big is the tear.
Yeah, see, anyway, these meniscal surgeries are never an emergency. Unless you are in a lot of pain and the knee is locked and you cannot go with your daily activities, then it becomes a sort of emergency. But 99% usually the patients have pain relief. And even if you have a meniscal tear, you can go out with your life. So I always tell a patient for the next 2 months, 3 months, observe your knee. If your right knee is giving always more problems than the left knee and is recurrently happening, that's because it hasn't healed.
True.
So in that case, it has to be done. Tone meniscus in an MRI is never an indication for a surgery.
Yeah.
If it is giving you symptoms, definitely it's an indication for surgery.
But again, as you said that, yes, it's not an emergency, but at the same time, it's better to do it because if the tear gets bigger, it will prevent, it will help to do it earlier. Earlier prevention better than later on. That,
and as a surgeon also, I would prefer to deal with simpler cases than complicated cases.
of course.
So a thing which is simple in the beginning can be fixed easily. Whereas like if you keep on delaying it, secondary problems happens and it all adds up and it becomes difficult as a surgeon as well.
And doctor, what is the usual recovery time?
As I explained, like if it is a meniscus problem, usually the recovery is pretty good. Normally patients start walking in same day, and usually within a month, patient is almost back to normal. Whereas if it is a meniscal repair, sometimes the repair has to heal. So it may take up to 2 months, 3 months. But during this 2 months, 3 months time, the patient is active. Only thing we are restricting you from active sports where there is a lot of twisting, turning, unexpected movements happening.
Of course, because...
And there is another one, there is a commonly done as an anterior cruciate ligament, ACL surgery.
ACL, yes.
ACL is little more painful. So usually the patient can have a little bit painful period for 2 to 3 days, up to 7 days. But after 7 days, 10 days, patients are almost back to normal. They need a lot of physiotherapy. So at the end of 2 months, 2 weeks, 3 weeks, the patient is almost normal.
Yeah.
But like we restrict them from active sports up to 6 months.
Up to 6 months about
So
that.
usually when a patient says like after surgery I can't do things up to 6 months, it's not the daily routine. It's basically sporting activity. That too unpredictable ones. The predictable ones like swimming, cycling, walking, running can be started earlier as well.
All right, doctor, I got a question is that I have a ligament problem. I visited the doctor and he advised me to take some antibiotics to heal and watch it. What's your advice about that?
See,
It's not
antibiotics
clear.
mostly for if he is suspecting infection, or like most probably it might be an inflammation. So he might be started on an anti-inflammatory as well. That is a possibility.
So the meniscus can get an inflammation, I mean.
Yes. So usually, as we said, a lot of problem heals by its own. Body take care of it. So usually when you give time, you're trying to heal by itself. In case if it's not healed, definitely it's going to give him pain,
Pain,
swelling, and all
correct.
those things. In that case, definitely it has to be looked at.
How would I know, okay, doctor, that this is the right time that, of course, besides pain, how would I know that I should visit the doctor because of my knee? I might find it maybe a little bit hurtful, yes, but I can move.
Yes.
Sometimes the pain comes and goes away.
Yeah.
So when is the best time?
No, see, the pain in the knee is a common reason to visit a clinic.
Correct.
So sometimes we end up investigating, doing things, and we find it's all okay. Only thing we advise them is to lose weight, keep doing exercises. But usually, if it is not only pain, if the knee is getting swollen, repeatedly it is getting effusion, that's a fluid collection in the knee. If the
Okay.
knee is getting locked, like when you move the knee, it starts getting locked at certain position and it becomes painful. Or
Locked, it means, doctor, that you cannot move
yes,
your leg at all.
yes, that
Okay.
means there is something coming and hindering the movement in between. So
Okay.
that means something physically is coming in between. So that's why it's getting locked.
So that's kind of the time
And
to go.
the most important thing is instability. For example, a knee here is stable by itself, but if the ligaments are torn and the muscles are not holding, you feel like the knee is slipping out. You will have a wobbly knee.
Okay.
If you have a wobbly knee or you feel like it's unstable enough, that definitely indicates there are some problems with the ligaments inside.
And doctor, who's the most common people that they might get the injury in the ligaments? Are the sport people can get it? The people that play in gyms
Yes.
or
So
cycling?
no, it's always about unpredictable activities. You said cycling. Cycling is a very predictable thing. So if I end up doing the same exercise like repeatedly, it actually improves my muscle. It is not inviting any injury. Whereas if I am into football, I have to run, suddenly twist. I
Yes,
have to
because you
kick
need
the
to kick
ball.
with the ball.
My friend may come and kick me on the knee. So
Yeah.
these are injuries. So
That can
somebody
happen.
who is into sports, like which are physical in nature, which is unpredictable in nature, will always have these sort of ligament injuries.
They will have it more.
Whereas somebody who is into predictable things like swimming, cycling, running, will not have much.
What about doctor walking sometimes and you get swollen like inflamed?
Yes.
What might be the reason that you might have the swollen and inflammation?
See, as you asked, walking is a very good exercise. But walking is an exercise for your upper body. It helps you to lose weight. It improves your stamina. It improves your cardiovascular status. But at the end of the day, walking induces load on the knee. So
True.
if I walk for 10 kilometers, advantages is what I explained. Disadvantages, knee pain. So ultimately, if I'm a walker or a runner, I should have strong legs. So to get stronger legs, I should be doing some leg exercises separately.
To help out.
Yes.
Doctor, a question came that I'm not sure how, but Does the shoes affect my knees if I wear high heels?
Yes,
Would it affect
no,
in...
see, it's all about getting used to. For example, if somebody has been quite used to a high heel, obviously they shift to a normal heel all of a sudden. It may cause a strain pattern.
So you mean that the ankle or the knee, I mean, sorry, I'm calling it the ankle, like it adapt
It adapts,
on
yeah.
your physical or your way, how you're living and what you're wearing.
Yes.
If you change suddenly and you start, I don't walk on thin, but I walk suddenly, it might affect my knee and get swollen or have some
Yes,
problems and
yes.
turn or play football suddenly.
Yes.
So,
So ultimately, changing a shoe or wearing a comfortable shoe will give you a temporary relief of the symptoms, but not permanent. Whereas once you start nurturing your muscles, you start developing the muscles, restricting to stretching exercises, very light exercises on a daily basis, especially concentrating on quadriceps and hamstring. That will take off the load of the ligaments and the meniscus. Obviously, giving you a better mileage, I would say.
yes, true.
Okay.
Because I heard a lot of my friends that they're going and doing surgery for the meniscus and they have ligament problems. So, why we were playing football, something happened.
Yes,
The
because
normal,
everyone
common.
enjoys sports.
Of course, yes.
Everyone hates the boring stuff, exercising.
The gym is kind of boring, but
Yes.
but it doesn't affect. Okay, doctor, what is the age we can say that they might get affected? Like, I'm not gonna say, I don't know if children, I don't think when the age of 15 to 20, they might be fine.
Yeah.
They don't get it usually, even that if they play sports. But what's the range age that they might get
No,
the
normally
ligament
up
problem?
to the age of 15, 16, since the bone is growing, tissues are being replaced. So an injury can heal. So ultimately, a surgical problem in an adult
Yes.
can actually heal very beautifully in a child because the blood circulation is pretty good. And as they grow, the tissues are replaced. It regenerates quickly. So after 15, 16 years, I always consider kids as adult. So ligament injuries in a 15-year-old, 16-year-old always can be classified as an adult injury.
Yes, of course, because he's older.
Yeah.
But let's say the old generation, which is like from 50 above, would they have this problem? Because I don't think they move a lot, but is it
Yeah, see,
common?
it's not a good way to classify people based on the number. I have seen a lot of 40-year-old acting like 60-year-old.
Yeah, of course. I'm
There
not
are a
saying
lot
as a
of
number.
so finally it's all about how good the knee looks. Like if a 60-year-old comes to me with a ligament injury and automatically he's into sports, he's doing everything and he's quite active, then he may require, for example, a ligament surgery.
Yes,
There's
because
no
he's active,
yes.
but his body.
But-
So because the body will go weaker and the
Yes.
muscles will go weaker. I don't know if like the inflammation. The question is that the inflammation in there. How does it happen, doctor? Like we said that turn. We were talking about turn the meniscus over here.
Yeah.
But what's the inflammation? How does the inflammation affect?
See, there are two kinds of situation here. There are, as I classified earlier, there is acute traumatic injuries and there is a delayed degenerative tears.
Yes.
So just like if I was in my 20s, I will have everything fresh. My cartilage is fresh, my meniscus is fresh, ligament is fresh. So if it's torn, I would try to fix it. As I get older, by the age of 50 or 60, I've used these ligaments for 50 years. So it's already degenerated.
Yes.
So the quality of these tissues will be very bad. So even if you try to repair it, you may not win. So ultimately, that's why like as people cross over 50, 55, we start talking about replacements, not repairs.
Yeah, replacement.
Just like our car tires, if it is just ran for 10,000 kilometers and you have a puncture, you will repair it. After 60,000 kilometers, tire is worn out.
Of course, you need to
will,
change it.
You will replace
So
it.
you replace it, you put something.
That's a totally different subject. Basically, like you try to replace the whole thing, like you tend to put metallic cap over the kneecap
Okay.
with a spacer.
That's completely different.
Yes.
But doctor, just the last question is that, is there kind of injection which you do to help the ligament in there?
See, there are a lot of studies which has come in, especially which is related to plasma-rich proteins, which is called the PRP injections,
Correct.
which can help, but like studies are still not good enough
confirmed,
to really support them.
So you
it's
don't use them yet, or
not
we
much,
don't?
not much.
Okay, that's perfect for me because I heard about the injections, so I was like to check. Thank you, doctor. It was very amazing. You answered all of my question, and I think we finished. Appreciate your time. Thank you, doctor.
Okay. Thank you, Anas, for the questions, and definitely the interaction was there, and it was a nice
Thank you so
interactive talk. And just concluding, so we were essentially talking about a knee ligament injuries. So some are surgical, some are conservative. So obviously we are dealing with it in our hospital. That's our Medcare Orthopedic and Spine Hospital. So we are available 24/7. If you have any issues, you're always welcome. Keep exercising, keep strengthening your knees so that you don't have any ligament injuries. Thank you.
Medcare Orthopedic and Spine Hospital, specialist orthopedic surgeon. Available. Appreciate your time.